Phlebotomy certification tips. Question 1. When a specimen label differs from ID band, phlebotomist should: Option A, draw anyway. Option B, correct on computer later. Option C, re-verify patient and relabel. Option D, ask another phlebotomist. The correct answer is option C, re-verify patient and relabel. Any discrepancy between the specimen label and the patient's ID band must be resolved before collection by re-verifying the patient's identity using two independent identifiers. Drawing without resolving the discrepancy is a critical patient safety error. Question 2. An evacuated tube fills by: Option A, capillary action. Option B, gravity. Option C, vacuum. Option D, syringe suction. The correct answer is option C, vacuum. Evacuated, Venipuncture, tubes are manufactured with a preset vacuum that draws blood into the tube automatically upon needle-to-vein contact. The vacuum is calibrated to fill the tube to the correct volume to additive ratio, making proper fill critical for accurate results. Question 3. If a hematoma begins to form, the phlebotomist should: Option A, continue drawing. Option B, remove needle and apply pressure. Option C, apply cold compress only. Option D, massage site. The correct answer is option B, remove needle and apply pressure. Upon observing hematoma formation, the needle must be immediately removed and firm direct pressure applied for 3 to 5 minutes to stop bleeding. Massaging the site can worsen bruising, and continuing the draw would further damage the tissue. Question 4. Which action may cause hemolysis? Option A, gentle inversion. Option B, vigorous shaking. Option C, correct needle gauge. Option D, proper tourniquet placement. The correct answer is option B, vigorous shaking. Vigorous shaking creates mechanical shear forces that rupture RBC membranes, releasing hemoglobin and intracellular contents into the plasma. Gentle inversion, not shaking, is the correct mixing method. Tubes should never be vortexed or shaken. Question 5. What is the first step in routine phlebotomy procedure? Option A, wash hands. Option B, prepare tubes. Option C, apply tourniquet. Option D, identify vein. The correct answer is option A, wash hands. Hand washing is the absolute first step in the phlebotomy procedure and is required before patient contact, equipment preparation, or any other action. It is the most effective measure against healthcare-associated infection transmission. Question 6. How should a heel stick be performed on an infant? Option A, medial or lateral plantar surface. Option B, center of heel. Option C, arch of foot. Option D, toes only. The correct answer is option A, medial or lateral plantar surface. CLSI guidelines specify that infant heel sticks should be performed on the medial or lateral plantar surface of the heel to avoid the posterior curvature and calcaneus bone. Puncturing the center or arch risks bone injury, osteomyelitis, and nerve damage. Question 7. A specimen should be transported to the lab. Option A, at the end of the shift. Option B, as soon as properly labeled. Option C, only at morning rounds. Option D, after refrigeration. The correct answer is option B, as soon as properly labeled. Specimens should be transported to the laboratory immediately after proper labeling to minimize preanalytical degradation. Delays can cause cellular metabolism, evaporation, and analyte breakdown, particularly critical for glucose, potassium, and coagulation tests. Question 8. For proper specimen identification, labels should include: Option A, patient name, ID number, date/time. Option B, only patient name. Option C, only date. Option D, only test type. The correct answer is option A, patient name, ID number, date/time. Complete specimen labeling requires at minimum the patient's full name, unique identifier, medical record number or DOB, date and time of collection, and collector initials. Incomplete labeling is a critical error that can result in specimen rejection or patient misidentification. Question 9. The antiseptic used for blood culture site preparation is: Option A, alcohol only. Option B, iodine or chlorhexidine. Option C, saline. Option D, hydrogen peroxide. The correct answer is option B, iodine or chlorhexidine. Blood culture collection requires rigorous antiseptic preparation using povidone iodine or chlorhexidine gluconate to minimize contamination risk. Alcohol alone is insufficient for blood cultures due to its limited activity against skin flora in deeper layers. Question 10. How should blood from an 4 line be collected? Option A, above foresight. Option B, below foresight after turning off infusion. Option C, from same 4. Option D, ignore 4. The correct answer is option B, below foresight after turning off infusion. If no alternative site is available, blood may be collected distal to below the foresight after the infusion has been discontinued for at least 2 minutes and the first 5 ml discarded to clear for fluid contamination. Drawing from or above the foresight produces diluted, invalid results. Question 11. An inpatient ID must include: Option A, name and physician only. Option B, name and date of birth. Option C, allergy status only. Option D, billing information. The correct answer is option B, name and date of birth. At minimum, 2 patient identifiers are required for inpatient identification: full name and date of birth, or medical record number. These must be verified against the patient's ID band before any specimen collection to prevent patient misidentification errors. Question 12. Icteric specimens are caused by: Option F, high lipids. Option B, high bilirubin. Option C, low glucose. Option D, high potassium. The correct answer is option B, high bilirubin. Icterus refers to the yellow-orange discoloration of serum or plasma caused by elevated bilirubin levels, seen in conditions such as liver disease and hemolytic anemia. This is distinct from lipemia, milky appearance, and hemolysis, pink-red discoloration. Question 13. What is a common use of fingerstick blood? Option A, CBC. Option B, blood glucose. Option C, blood culture. Option D, coagulation studies. The correct answer is option B, blood glucose. Point-of-care blood glucose monitoring is the most common clinical use of fingerstick capillary blood. Blood cultures require sterile venous samples, coagulation studies need precise venous volumes, and while CBC can be done on capillary blood, it is not the most common fingerstick use. Question 14. Which of the following is considered a standard precaution? Option A, gown only. Option B, hand hygiene. Option C, mask only. Option D, no precautions. The correct answer is option B, hand hygiene. Hand hygiene is the cornerstone of standard precautions and is required before and after every patient contact regardless of glove use. Standard precautions apply to all patients and include multiple measures. No single item like a gown or mask alone constitutes standard precautions. Question 15. For a 2-year-old child, the best collection site is: Option A, heel or finger. Option B, ankle vein. Option C, femoral artery. Option D, basilic vein. The correct answer is option A, heel or finger. Capillary puncture from the heel or finger, lateral fingertip, is preferred for young children when small volumes suffice, as it is less traumatic and safer than venipuncture. Femoral and basilic sites carry higher complication risks and are not routine pediatric choices. Question 16. The abbreviation STAT means: Option A, standard time. Option B, immediately. Option C, soon after tomorrow. Option D, scheduled test. The correct answer is option B, immediately. STAT is derived from the Latin statim, meaning immediately. STAT orders require specimen collection and processing with the highest priority, typically within 30 to 60 minutes, and are designated for critically ill or time-sensitive clinical situations. Question 17. A patient with latex allergy should be drawn using: Option A, latex gloves. Option B, non-latex gloves and supplies. Option C, standard tourniquet. Option D, no gloves. The correct answer is option B, non-latex gloves and supplies. Patients with documented latex allergy require a latex-safe environment, including non-latex gloves, nitrile or vinyl, latex-free tourniquets, and latex-free bandages to prevent potentially life-threatening anaphylactic reactions. Question 18. Which is a complication of repeated venipuncture? Option A, hemophilia. Option B, vein sclerosis. Option C, anemia only. Option D, hypertension. The correct answer is option B, vein sclerosis. Repeated venipuncture in the same vein can lead to sclerosis, fibrosis, and hardening of the vein wall, making future access difficult. Phlebotomists should rotate puncture sites to preserve vein integrity in patients requiring frequent blood draws. Question 19. Which is the safest way to remove needle after venipuncture? Option A, recap using one-hand technique. Option B, pull and shake. Option C, recap two-hand technique. Option D, leave in patient. The correct answer is option A, recap using one-hand technique. If recapping is necessary, the one-hand scoop technique minimizes needle stick risk by keeping the free hand away from the needle path. However, best practice is to activate the safety mechanism and dispose directly into a sharps container without recapping at all. Question 20. The most common complication of venipuncture is option F, infection. Option B, anemia. Option C, hematoma. Option D, syncope. The correct answer is option C, hematoma. Hematoma formation, caused by blood leaking into surrounding tissue, is the most frequent complication of venipuncture. It typically results from improper needle placement, premature needle withdrawal, or insufficient post-draw pressure.